Okay, good morning.
Good morning.
There we go. So I'm Kimberly Cole. I'm a professor and extension specialist. So that means that I work with adult horse owners throughout the state of Ohio. And I also work with the 4-H horse program, the youth program. So with a lot of youth throughout the state. I teach a lot of undergraduate equine classes at the university. So I incorporate horses in a variety of ways in my daily activities through teaching, research, extension activities. For that, so that's a little bit about my background. I have my graduate student Nicole with me, and she'll introduce herself.
So hi, I'm Nicole. I met some of you yesterday, which was awesome. I am also at the Ohio State University, like Dr. Cole said. We are working together on my dissertation project, which is equine assisted services focused. And we'll talk a little bit about that in the presentation. I do some teaching in the Department of Animal Sciences, and I do like to spend my time with horses when I can, but some of my classes are focused on other species as well.
So one of the classes that I teach is focused on equine assisted services in a way. It's not what it's called, and we'll talk about that in a second. But we also both are members of and work with the Center for Human-Animal Interactions Research and Education. It's a mouthful. We call it CHAIR. Big focus on human-animal interactions. Our area has been with equines. We've done a lot with different species, canines, rhinos. We've done some rhino research, lots of different things, using novel animals and looking at the educational value, but also the behavioral and physiological benefit of working with those animals. Equine assisted services is not the name of the course that I teach. I've been teaching it for about 6 years. It's called Equine Assisted Activities and Therapies. Some of you might hear something along those lines. So I did want to say thank you to the group of dedicated individuals, some of who are here with us this weekend, that work together to come up with the term equine assisted services that refers to all of those multiple services that we use where we incorporate horses and other equines to benefit people. So that's what we're going to be discussing today, is a biobehavioral approach to this.
And thank you for utilizing it.
Thank you for that, because it was, when trying to come up with the name just for the syllabus 6 years ago, what do we call this? How do we communicate this to the students that we're actually not providing the services to the university? And what's the difference in therapy? And that was one of my main reasons for the class, is with the equine program, the undergraduate program. I had a lot of undergrads that just love horses and wanted something to do with them, that they weren't going to be a veterinarian, weren't going to be a farrier or a trainer. So they thought, okay, well, and a lot of them, we'll do therapeutic riding, or we'll do some type of equine assisted services. And that's not how that works, right? So we know that, they didn't know that. So at the time, and we still do, we actually partner with some local organizations that utilize our facilities and our horses to provide equine facilitated psychotherapy. We've had corporate development groups come in from as far away as New Mexico, where they meet and utilize our facilities and services. So in working in those capacities as well, working with students in College of Social Work, kind of really put together this syllabus and developed these programs and have done some research in this area. So we know that equine assisted services benefits people. Lots of different benefits, lots of research to talk about that, everything from decreasing heart rate and anxiety and decreasing blood pressure and improving communication skills, leadership, confidence, self-esteem, increasing emotional awareness. I could go on, and I see everybody nodding their heads because we know that it does these things, but we have some challenges, which is why we are all here, because we need more research in a lot of different areas. But as we're starting to do that research, we need to make sure that we're doing the right research that's going to help further our field, our passion of equine assisted services for those that need those benefits, so that way insurance and other facilities can help provide those services a little bit easier for them. So we know the benefits to people. But what about the equine participants? In my role, working with the youth and the undergrads and an educational component, we have to consider, yes, we can incorporate them, but what about them? What about considerations for them? And there's a lot of different avenues or approaches that we can take to that, but it is important to consider them for a lot of different reasons. So that's going to be what the focus of our presentation today is, not on the research that can benefit people, but what do we need to consider about the equine participants?
So that kind of leads us to a conversation about animal welfare. So I know all of you in this room have heard the term animal welfare before. We mentioned it yesterday. I'm sure you hear it all the time. It's kind of this hot button term that we hear, kind of everywhere, I feel like, these days. And so animal welfare, you might hear it say like, oh, that dog has poor welfare, or that horse has great welfare. And in reality, welfare and welfare assessments are not necessarily these subjective terms. There is a way to assess animal welfare, and we can do that through a couple of different modalities. So you may have heard of, if you're familiar, you may have heard of the 5 freedoms model or the 3 schools model, but today I want to talk about the 5 domains model of animal welfare. And so this was developed originally in 1994 by Dr. Meller and colleagues. It's been kind of updated several times throughout since then, and the most recent update is as of 2020. And what I think is, well, there's a few different interesting or useful things about this model, but one thing is that it doesn't just focus on minimizing the negative health or negative welfare concerns, but also maximizing positive welfare opportunities for animals. So we see that in 5 different domains: nutrition, health, behavioral interactions, and physical environment. You say, well, that's only 4 domains, and that's because the 4 domains are all going to contribute to the 5th domain, which is the animal's mental state. And so this model kind of poses that the mental state is the animal's overall experience, and that's essentially that makes up their welfare. So whatever their experience or their mental state is kind of how they're coping with their environment or their welfare. So we have these 4 different areas. Again, it can be either the negatives or the positives. One thing I wanted to highlight in this most recent update is in the behavioral interactions category. And so in this 2020 update, we see that human-animal interactions are playing a huge role in animal welfare. And so that is really relevant to us as individuals who are interested in equine-assisted services, because when we are interacting with the horse in the capacity of services, equine-assisted services, it's a human-animal interaction, right? So we've got potentially volunteers or sidewalkers, depending on what's going on. We have the instructors or facilitators, we have the participant. So all of those individuals are interacting with the horse, and that's going to influence what's going on with them during that interaction and overall. And so the terms welfare and well-being tend to be used interchangeably, but in fact they are actually not the same thing. When we think about measuring welfare, we're talking about that whole picture, all those puzzle pieces combined. So assessing each of the 5 different domains. When we talk about measuring well-being, we're talking about potentially just measuring one of the different domains. So in the context of equine-assisted services, we might not be able to measure the animal's entire welfare during the interaction, but we can certainly measure their well-being, or one component of their welfare during this time. So that leads us to different types of measurements of animal or equine well-being or animal well-being. So we're going to talk about different biological measurements, and then we'll talk about different behavioral measurements. And to start, we'll start with heart rate and heart rate variability. So we hit on this a bit yesterday. Heart rate variability is something that is kind of up and coming. It's useful, but it is pretty complex. It can be, both heart rate and heart rate variability can be influenced by age, exercise, excitement, or stress. We're talking about this term stress over the last couple days. And they can have different influences on these measurements. So when we see increased stress, right, this term that is kind of ambiguous, we see usually an increase in average heart rate, and a decrease in heart rate variability. And remember, heart rate variability is that the measurement from the R to R intervals in the QRS wave of the
EEG.
EEG, thank you. And so it can be complex, but overall, if we're seeing those measurements, that's kind of what we're looking for.
And I was very encouraged yesterday to hear that the research with the polar heart rate monitor was supported by the EEG, because that's what we've been using as the polar monitor on both horses and humans. So very relieved to hear another support of that. So in addition to heart rate and heart rate variability, one of the other biological measurements that we heard a lot about yesterday was cortisol. But cortisol has some nuances that we need to discuss, because it can't be the only thing that we throw out there. So cortisol is activated by the HPA axis. It's a steroid hormone. So this is activated during a physiological or psychological stress event. Now, that stress event can be short-term in terms of horses with that fight or flight response. And we'll talk a little about eustress and distress in a minute. But chronic stress, so prolonged elevated cortisol, can be detrimental to our body, horse's body, our body, and have different health implications. So we want to avoid that chronic stress. We talk about eustress and distress. So there are different forms of stress, although when we use the term stress, it's usually referring to that distress aspect, but we're not specifying that. So eustress is a good thing, it's especially for horses. It's that fight or flight. It helps keep them alive. But the distress is the negative type of stress that has potential implications on their health, especially if it's prolonged, the cortisol's elevated for prolonged periods. So we want to make sure that we're referring to the correct stress, because not all stress is bad. So that's important. So when we're saying stress, we have to be careful in terms of what type of stress. Is it physiological stress, psychological stress? Is it acute stress? Is it chronic stress? So with that, we have a lot of different sources that we can sample to measure cortisol levels. Some of those we have already talked about this weekend. So plasma or blood plasma cortisol levels, salivary samples, even urine and feces. All of those are short-term measurements. Some of them, the urine and feces, have a little bit more lag time. Some of them have pros and cons to sampling. For plasma, you've got to draw blood. I'm not a big fan of a needle stick, and sometimes the needle stick stress can even cause elevated levels of cortisol because it's so instantaneous. Saliva, a little bit longer, but again, you've got to collect the spit, and we actually use Aviva's model, the BIT model, to collect salivary cortisol. Works really, really well. Urine and feces, not so fun to collect. Wouldn't want to do that from humans or the animals. We've done some fecal cortisol, but it's the correlation or the values aren't nearly the same as what we see in the plasma and saliva. And these samples only measure acute cortisol, that snapshot in time, that instantaneous. So if we're looking at getting a longer picture of what's going on with an animal, we have to take multiple samples over time to do that. So that can be a bit problematic, whether in a research or a realistic setting to do. So one of the things that we have used in the past couple of years is hair cortisol. So taking hair samples. So this is actually started in humans a couple of decades ago, and it can be influenced by what we do to our hair, but we don't dye horses' hair, we don't curl it, they don't smoke, so we don't have some of those same issues with hair sampling. So we've measured or taken samples at different parts of the body to see, because they have different growth rates, because that does influence our results. But what's one area of a horse that is routinely clipped or shaved? Can anybody tell me what that is? On a horse, what's an area that's routinely, or cut with scissors maybe? Yes, their bridle path. So very common in the horse industry. So no one's really going to want a big swipe missing out of their horse over and over again, on their body or somewhere. But fortunately, some studies have shown that the mane hair, especially in the bridle path, we can clip that repeatedly and measure the length of the hair, so that way we can collect it every 30 days, every 60 or 90, or wait till 90 days, cut it, and then segment it so we can determine the rate of growth. And then we can actually measure cortisol in our hair samples. And that gives us a picture over time. And really from a management standpoint, that's what I'm interested in. So when I have a group of young horses that have grown up outside in group housing, and then I bring inside at the beginning of the semester to live in individual box stalls, I can see how behaviorally they respond to that, but how am I influencing their well-being for that? So in our studies that we did, when we took samples, their hair samples, prior to them even starting the study, so in the fall, then again before they moved in, and then again at the end of the semester, we did see an increase in the first 30 days after they moved inside in hair cortisol concentrations. But then for the next 60 days, they returned to baseline levels. So yes, they did experience a change that we were able to pick up in hair cortisol, but they were able to acclimate to their environment. For that. So that was interesting for me to see over that prolonged period, and I didn't have to go out and take a blood sample or saliva sample every day to do that, and that would also be a lot more costly. But also one of the challenges that we have with cortisol sample is that they experience rhythms, both circadian or daily rhythms as well as seasonal rhythms that we must account for. So if you're going to take short-term samples over a period of time, you've got to take them around the same time every day. And then if it's over an extended period of time, you've got to account for seasonal differences in those. So when we talk about cortisol concentrations, we have to look a little bit deeper in how are we talking about those, because you might not be able to compare a January sample to a July sample. So if we do that without that context, we might get misinformation and not fully understand what we're looking for. So that's really important when we're using that particular metabolite. But it's a very common one. It's very reliable. Assays have been validated in many species. So it's kind of a good one to start with.
So that kind of brings us to the next one, which is oxytocin. We mentioned this also yesterday. Oxytocin is, we might think of it as like the love hormone or the happiness hormone. We see it in a couple of different contexts. And so it is produced in the brain. It's released by the posterior pituitary gland, both into the blood, so into peripheral circulation, or through the blood, and then into the brain as well. So it can act as a neurotransmitter. So when we see it in the blood, we might think of it more in terms of being released during labor or during lactation in women or in horses. In the brain, that's where there are receptors in the brain that are contributing to it being this happiness hormone or this relaxation hormone. So when we see it we see increased social bonding, we see increased relaxation, we tend to see an increase in oxytocin. It makes sense. When we see an increase in oxytocin, actually oxytocin is acting on the HPA axis, and it can act as a buffer to that, so as a stress buffer, because it's acting on cortisol and can reduce cortisol production. And so that is why we see those types of effects with oxytocin. As far as measuring oxytocin, it's gone through some difficulties in the past, but we're coming a long way with measuring it. So originally, when it was first discovered, if we wanted to measure it centrally or as kind of this neurotransmitter, we needed to measure it in CSF, or cerebrospinal fluid. We had to do a spinal tap to get that, and that's obviously very challenging. Can't do that just in any setting, right? But now we know we can measure it in plasma or in blood, and the peripheral concentrations do correlate with the central concentrations, which is good to know. We also now see it in saliva. So Aviva was talking about this yesterday. We are also measuring it in saliva. We can measure it relatively non-invasively, as long as whoever's giving it doesn't mind giving spit, or however you're measuring it. But it can be measured in that way. There are some challenges still with oxytocin, so we still have some way to go. It has a very short half-life. It's about 6 minutes long. So it can be very difficult. You have to either freeze it right away once you take it, or analyze it right away, which can be complicated. So we do have a long way to go, but it is certainly possible. We realize that now.
So cortisol and oxytocin are probably the more common ones. Cortisol definitely, oxytocin new in the last few years in terms of, especially in horses. In humans for quite a while, and other animals for quite a while. So one of the new areas for horses or for animals in regards to behavioral interactions or psychological interest is the measurement of pro-inflammatory cytokines. The measurement of these is not new in animals. I've measured these, but it's been in regard to antibody responses, so vaccine development, immune disease challenges. So this isn't a new metabolite to study. However, the use for humans, its role or their potential role in neurological disorders is becoming more and more understood, not understood very well, but it's an up-and-coming area. So following along those lines from the neurological and the neuroscience area, we also are able to collect these samples in blood and in saliva for that. So we want to be able to analyze these because they come in at different points than cortisol and oxytocin, so they will support, hopefully, or give us a better understanding of those cortisol and oxytocin concentrations that we're seeing to provide a better understanding of that overall picture. So a variety of them, but we're looking at the pro-inflammatory ones like interleukin-1 beta, IL-6, IL-8, and TNF-alpha. There are some anti-inflammatory cytokines as well that could be measured, but in terms of their role in neurological concerns in humans, it's really the pro-inflammatory cytokines that they've been seeing some differences in. So we talked about biological approaches, but there are also behavioral approaches that we can utilize when evaluating human-animal interactions. Some of these are the novel object test or reactivity or sensitivity test that we can do to sound, taste, smell, those novel objects. There's a lot of different ways to evaluate those, to set those up for an animal to do. There's a lot of literature out there on these, so I'm not going to go into all of that because sometimes we see mixed results with that as well. But there are a lot of different ways to do those and to observe and record what we see. So that's a great way to do behavior, but a lot of times it depends on the type of study that's being done and the question that's being asked.
In behavioral measurements, we also see ethograms. So ethograms are, essentially a list of different behaviors, and it's species specific. It can include things like resting, locomotion, ingesting. So it can be species specific behaviors. And what happens is an individual will observe an animal as an individual or in a group and take note of the amount of times the animal displayed this particular behavior. So they're quantifying those behaviors, and it can be put into what's called an activity budget. So it looks like this pie graph here. It's put in terms of percentages. And in the context of equine-assisted services or human-animal interactions, we can see this and hopefully get an idea of how many times the animal interacted with the person, or how much time did they spend not interacting, how much time did they spend potentially displaying abnormal or even maybe stress behaviors. And so this can help us to understand what's going on in the interaction. Kind of along the same lines, we have measurement of facial expressions. So in 2015, Walthen and colleagues developed what's called the Equine Action Facial Coding System. Sorry, I said that backwards. It's Equiface's Equine Facial Action Coding System. And so what they did is they were able to understand all of the ways that a horse's facial muscles can move in response to different stimuli. So essentially what facial expressions they're capable of making. And this facial action coding system can be used in different contexts to quantify what behaviors are being displayed or what facial actions are being displayed in response to different situations. So there was a study pretty recently, it's 2021 by Loonbald and colleagues, and he and his friends found that in response to certain stressors, different facial actions are being displayed. So increased white of the eyes, increased display of the upper eyelid raiser, and that's, you see my mouse here. So horses don't actually have eyebrows, but they have movement that's similar to kind of the human worried eyebrow look, the furrowed brow look. And that is displayed, or was found to be displayed more in the context of this stressor situation. And then another pretty common facial action that you guys as equine individuals are familiar with is what's called the ear flattener. And that can definitely be displayed in a variety of different situations or experiences that the horse is having.
So that was just a brief overview of some of the different biological and behavioral approaches. So there are some challenges that we have. Typically, well, we know that more research is needed, right? We're all here, so we are interested in research. Typically, when we have a study, we follow one approach. So either a biological approach and do measurements in one area, or a behavioral approach and do those. Very few studies combine both. So just think for a second, and just off the ones we listed, do you think that one of these approaches is better than the other, or one area? How many of you, raise your hand if you think that a biological approach is superior to a behavioral approach? Okay, raise your hand if you think a behavioral approach is superior to... Okay, finally, I had to put my hands on the hips to get some raised hands. So it's a challenge because it depends on the question, depends on the context of the study. Why not do both? So in some, well, we'll talk about this for a second. So this is Bugs. I always like to introduce Bugs. She's no longer with us. But Bugs was known in our teaching herd. She had the ability to make several different facial expressions in a relatively short period of time for that, depending on her environment. So this might have just been, continuous clicking of the camera every split second. And we've probably seen these or similar facial expressions in the horses that we're around. So from a behavioral standpoint, we might code these a particular way. Angry, stressed, excited, irritated, sleepy, alert, different ways. So when we do the behavioral research, either one person, so that way we're consistent, one person codes all the observations, or the people that are coding them are trained, so that way they're consistent, and we do reliability tests to make sure that all the people are on the same page. So when we take this, and then if we wanted to add biological measurements, easiest one in this case, heart rate, do you think that the heart rate would be higher with one of these particular facial expressions? How many of you think the one on the left with the ears kind of face backwards would have the highest heart rate? Okay, how about the one in the middle with the ears forward? Okay, how about what we call angry face on that? So everybody's got a little bit of a different opinion. Well, it was with the one on the left. This one, no change in heart rate. She could do this, and I had a student that did a study evaluating hoof care procedures and the effect on heart rate. Whether if just picking up their hooves, hoof picking them, trimming, did it make a difference which hoof you started with in their order, because the horses are used to routine and doing things a certain way. And was really surprised to find that the facial expressions and the heart rate were not matching to what her expectations were, even though she was an experienced horse person. So we have to be careful even though we're using multiple approaches, in how we look at that data. So we know that biological and behavioral measures are going to provide more context for us. I'm not going to go into this table because it's probably hard to see, but the take-home message is, this is from a study where my student was studying cortisol, but we also did reactivity tests, novel object tests. So we looked at cortisol, heart rate, and behavior for that. And what we found were that for some horses, so individual variation accounts for a lot. So for some horses, things were highly correlated. If they had a lot of reactivity to an object, increase in heart rate, increase in cortisol. And other horses, increase in heart rate, no reactivity. So we see a lot of individual variation. But taking these measurements together provides us context with how to evaluate those. So we're not saying, yes, this does this, because it does depend on a lot of different things. Where our interests are is that we think that biological and behavioral measures are important in both the horse and the human. So one of the studies that are not up here that it's great pictures because I made sure to get pictures in the elevator. We took animals to campus. And we use different animals a lot of times, being the Department of Animal Sciences. So we use dogs, goats, and mini donkeys because we varied the animals and we had a control, so video of the animal or the live animal in a pair. So regardless of the species, I took them up to the second floor of a dorm. So they got to ride the elevator, but we had to line it with paper just in case we had any accidents along the way.
And we did.
And we did. So taking donkeys in an elevator, quite entertaining. For that, lots of looks while they're riding, and walking through campus. But we were able to do a study where we were able to measure human heart rate, the animal's heart rate, and record behavior. So we're still working on crunching that data because it's important to take into that context. They also did psychological surveys before and after the interaction, regardless if it was the live interaction or our video control. So different ways, because sometimes the novelty of the animal may make a difference as well. I'm very interested in the touch, feel, and texture of the animal, and does that make a difference? Do I need live animals in my teaching activities? Or can I do things through video? For that. So that's another area of interest for me. We were talking about the mirror colt. That versus the live animal, does it make a difference? I would be curious in that type of study, not from the movement perspective, but from all of those other scales, those other approaches that we can measure. And then to finish up, I'm going to let Nicole talk about something that we've been working on.
Mm-hmm. So our current project right now is we are recruiting individuals from around Central Ohio, men and women who are adults, to come out to the farm and have an equine-assisted interaction or participate in equine-assisted services. And so they'll be coming out once a week for 4 weeks in a row. The interaction will be about 30 minutes in length, but they'll be interacting with the same horse every time for each of those 4 weeks. And they are individual sessions rather than group sessions. So on the human side, we'll be taking some biological measurements, including salivary oxytocin, pro-inflammatory cytokines, and then heart rate variability. And we'll also be taking some behavioral measurements on the humans, or psychological measurements. So we'll be doing several self-reported scales, including physiological and psychological trauma. So TBI, or traumatic brain injury, kind of a history of that, collecting that from them, and then also post-traumatic stress disorder, so we'll be doing a scale on that. And then a couple of other different anxiety type scales and things of that like. We are very hopeful, given what we've just talked about, that we can also take those measurements on the horses. We think that that's extremely important, and so we're kind of in the final planning stages of this study. That's my dissertation project, so wish me luck on that. But yeah, we are very excited for this project, and if we can, we'll be taking the same biological measurements on the horses and some video behavior on the horses to do facial expressions and
Frequency of
frequency
touch.
and touch, duration of touch, things like that. So yeah.
And this weekend has helped us in being able to take into account the information that we've learned. So this has been great for us to make us rethink and double check what we're doing. So thank you for the opportunity to present to you. I know this is an exciting area for us because I think the more research that we have that can support what we are passionate about is helpful. So thank you. And
We have about 5 minutes for questions.
yes, ma'am.
So when you're collecting for the cortisol, is there any difference? I know there was a study in the UK between the taking it from the bulb of the hair instead of the shaft.
Yes, so there's a couple of different pathways of incorporation, like either passively through sweat or internally into the hair shaft. So by taking it in the same area for that, and also length of time, because in order, at least for the hair cortisol, we need a certain weight of the hair in order to be able to do that. So that's what it's based off of, the weight of the sample in that shave. So we haven't seen any differences in and it's difficult to do. Where we have seen differences, because we did sea lion hair and rhino hair, which they don't really have a lot of hair except like on their tail for that and the rate of growth. So some of it depends upon the surface of the animal, like with the seal, with their ability to maintain that water seal on there. So some of that does come into play, but not enough where we saw differences within the species, differences across species in relation to their hair and how that hair is utilized on the body.
They did a study in the UK, I have it on my laptop, but they found that the cortisol stayed in the bulb of the hair for 24 hours as opposed to a very short length of time in the shaft.
Well, and it depends on the length of growth of the hair.
Of that shaft.
So we can, of that shaft, so we can segment it, and then also the oil on that can be problematic when assaying.
I think they did it on thoroughbreds or something, or
Okay.
pre-race and post, and so. I didn't
Interesting,
know.
and that's a quick turnaround for that shave. So we usually did because of the growth rate, no less than, or no long, try to do around 3 weeks. If we went before 3 weeks, it was really difficult to get enough hair in order for us to do, because we looked at different body parts, like, on the rump, because in other species, like with dog hair and then ape hair, they found that different locations on the body, they had different concentrations due to different growth rates in the
And
hair.
even different breeds of horses, so just traditionally, some are more plush coated than others. Yeah.
What we found really interesting, and I thought this was interesting, so I ended up having my grad student put it in there. So in dogs, they found that there are differences in cortisol due to the coat color.
Oh, that's nice.
So we found that when we separated out our horses with the bays and the blacks that had the black mane and tail versus the non-black mane and tail, significant
What
differences.
about chestnut?
They were in the non-blacks. So
You know where I'm going with that.
yes. So but it was the darker coat colors that had the higher. The red mares didn't have it as much. So that was interesting for us to
Yeah,
see.
that's
We weren't looking for that, but my student had read that in a paper about dog coat color, and we're like, well, let's analyze the data that way because we had it all. And sure enough, there were differences in coat color, but really especially between the black base and the non-black base coat colors.
Can I tag on to that real quick? In my other life, my professional life, is skin and melanocytes. And what you're saying is melanocytes actually produce two types of color, EO and pheomelanin, red melanin and black melanin.
Right.
Melanocytes are the only neural cell that exists outside the peripheral and central nervous system and go through dopa and quinone reactions to do exactly what you're talking about. And that's why you're finding the steroids there.
What about grays? Because they can have any base
Absence.
coat color. Absence. So we would see differences in coat color because we didn't have any
Here's your
grays in
girl.
our study.
Well, yeah, you go through your enzyme, go through your color and genetics there.
So it depends on that
It is
base
gonna
coat
track
color
different
regardless.
genetics.
Okay.
And it's really a hot topic that culturally is not talked about outside
Yes.
the melanocyte world.
Well, no, and that's what,
Melanocyte world?
There's a melanocyte world.
interesting.
I
The
heard
reason
that.
it's not talked about, the studies ended in the 40s culturally,
Okay,
because it was,
Okay.
yes,
okay.
Gotcha.
But that's interesting to know because we don't have a lot of grays, but if in doing hair cortisol, when we found that was one thing for us to notice, to make sure that, like when we blocked a treatment because of age of the mare or this or that we might have to block based on body coat color.
melanocytes will also get involved with serotonin, melatonin, and dopa,
Okay.
which affects your cortisol.
Because we were gonna look at dopamine or serotonin to measure, but we can't do that in saliva,
So
so.
indirect stomach studies, back to the amylase question from yesterday, we should talk offline.
Yes. Yes.
Question, has this level of the biological research been done in horses who have a history of trauma? That some programs are both human services and horse rescue, and so has anybody done a comparison on the biological differences?
Not that I'm aware of, because actually that's one thing, so going back to the domain, those 5 domains, we take demographics on the animals like age, gender, breed, work, history type thing. But I don't think I've ever read a study And maybe it's because of the studies that I've looked at that have had that type of intake history to look at experience, a trauma experience on the horse.
I think that is a good area where we're going, though. Like, I feel like we're still at that surface level where we're just trying to understand the horse. And I think eventually we can differentiate into, like, horse's history and different factors like that. So it's a really
I
good
can see
thought.
that being challenging
Yeah.
because sometimes we're not the primary or sole caregivers of that animal, so we may not know their history.
But
But if we did,
if you had a center that had that as a model, where they did sort of equine rescue, and then you might have more of that?
maybe blocking them by, I love the term that I heard Aviva or somebody mention here, level of quirk, or quirky level of the horse. That's a great, I'm going to use that in class for the students. And others say, you know, be careful of that one. She's got a quirky level of this. But that might be something that we could easily put in a column on a spreadsheet and then consider that when we're analyzing our data, just like we do age or, you know, other factors in there. Because like group housing, you know, are they in a stall, or they are intact male? Because some of the things that we measure also are influenced by their age and things like that. So heart rate is one especially. Higher heart rates in younger animals. My undergrad that did that one study, she's like, I saw, you know, I found significant differences. And I was like, oh yeah, in what group? She was like, the yearlings. I'm like, what's their average heart rate? Oh. You know, I was like, that's why we kind of go over those things. So some things can be easily influenced, but it's super easy to add that as a column in there to start looking at that, something like that.
Thank you.
Thank y'all very much.
Thank you very much.